Hi, my name is Rebecca, and today I'm going to show you how to do a Foley catheterization, insertion, and removal. I'm going to begin by gathering my necessary equipment. I have a couple washcloths to clean the perineal area and also for when I remove the catheter. I have some regular non-sterile gloves, and I have my sterile Foley kit. What I'm going to go ahead and do is I'm going to walk into my patient's room and introduce myself. I'm going to start and say, "Hi, Mr. Jones. My name is Rebecca. I'm going to be your nurse today. I'm going to identify my patient to identify peanut his wrist, and also on the computer. I'm also going to explain to the patient I am here today to do a Foley catheter insertion. I would double check also with the computer to make sure that he has an order from the doctor. I'm also going to check his allergies because we will be using betadine during the sterile process, and if he's got an allergy to iodine or shrimp, that could conflict with the betadine that we are using. So once everything of that has been checked and cleared, I'm going to go ahead and raise this bed up to about waist level so I'm not bending over and exerting my back muscles. I'm going to begin by removing the covers. I'm going to lift up his gown. And then I'm going to go ahead and do proper hand hygiene and wash my hands. Put on the non-sterile gloves. And then I'm going to go ahead and start by cleaning the perineal area. I'll start by dipping this in my little bucket of water. Start by cleaning. And then I'll go ahead and discard this. And then my gloves. I'm going to use the same pair later in the video, that way I'm not wasting gloves. Now I'm going to perform the sterile process. So I'm going to get my Foley kit. Go ahead and place it down. Start by opening away from me. Go ahead and open up the drape cloth and place it over. This is for a female, but we have a male patient, so I'm going to get rid of her. Get my sterile gloves. Open away. Now I'm ready to begin. I'm going to adjust my sterile tube a little bit and pull it close. I'm going to take my betadine, squirt it over the cotton, get rid of that, I don't need that. I'm going to take the lube, put it in the tray, and then I'm going to get my specimen cup ready. And then I'm going to go ahead and take this off. Attach it to the catheter. I want to do this before I start cleaning because this has to be sterile. Place that back in there. I'm going to go ahead and start cleaning. Take one cotton tip full of betadine. I'm going to go in a circle, and I'm going to discard this. Take the next one, clean it again. This way. take the third one, clean it, and then I can discard. Now I'm going to go ahead and insert the Foley catheter. I'm going to start by inserting it. With the male, you want to go at least 7 to 9 inches. So I'm going to go ahead and start until I see my flash of urine, and then I'm going to go ahead and go 1 more inch. And then what I'm going to do is inflate the balloon, so I would push this all the way down to inflate the balloon. That way it is secure and that it will not fall out. And then I can go ahead and remove this. And then now my sterile field is done. I can take these gloves off. And I can discard these. I'm going to put on some regular gloves. And now I'm going to go ahead and remove the bag. And then I'm going to take the end of the bag, unclip it so I can get my specimen. Pour a little into the cup, reclamp it, put the lid on, and now I can place that over here. And then I'm going to secure this part to the thigh with the thigh clamp. This would be removed. I would rip that part off. So this would be secured to his thigh. I'm going to take this and clip it on the bottom side of the bag to make sure it is below the bladder. And then I would rip this off. That way he would no longer have the drape. But to conserve my supplies, I'm going to keep this on for the time being. So then I'm going to ask the patient to make sure that he's okay and not in any discomfort. I'm also going to inspect his Foley bag because I want to look at the color and consistency of the urine. I also want to document the amount of urine that's in the Foley bag. I want to document the color of it, the consistency, make sure it's not cloudy. I want to also make sure that there's no other particles floating around in it. So I want to note all that in the Foley bag, and I also want to note the amount of mils of urine that was produced. So now I'm going to show you how to remove the Foley catheter. So I would have new sets of gloves. I would have a empty 12 or 10 cc syringe. I would go ahead and place it in here, draw it all the way back to get the fluid out. To deflate the balloon, I would squirt that out into the trash can, put this back on again and pull back just to make sure there wasn't any remaining fluid. I'm going to ask Mr. Jones if he could take a deep breath, and as he's exhaling, I'm just going to go ahead and pull this out. And that is how you do a Foley catheter, insertion and removal.